Episode 1, Why Young Athletes Are Breaking Down at Record Rates. Hi, I'm Dr. Tim Maggs, and welcome to the Concerned Parents of Young Athletes podcast. We're here today to try to increase the awareness of injury prevention in our youth athletes and to understand what we can do to make it a safer environment for them to excel, but also to reduce the risk of injury. And there's so many aspects to it of what we can do better and what we need to add to the whole equation. So we know that these young athletes go through a pre-participation examination at the start of the season, which is looking at the medical side of things. It's a medical screening. Very little biomechanical or musculoskeletal testing is being done, and then the seasons have so dramatically increased in the demands on these kids that the end result is a bad outcome. And we're seeing it in all of the premature breakdowns that are occurring at this age level. So we have year-round competition, and the competition isn't just year-round at our home stadium. Families travel to other states. The cost is enormous for families to have kids in sports, and there's never a break. With all of the different leagues, with the school season, with the AAU, with travel teams, and the fever to do better and have your child excel and be able to take advantage of future scholarships and the advancements that are available. It drives families to a point where it's really very injurious to the children and the youth athletes, and we need to at least be aware of it. Early specialization. We put kids in a position where they're repetitively using the same muscles, tendons, joints over and over during their growth years. And keep in mind, the foundation of everything we're going through now, they're on an imbalanced structure. No one is born symmetrical, so they have very unique imbalances. And then we put this loading through their body, and then early specialization, we make it the same movements, the same repetitive activity, and tissue cannot handle it. Tissue begins to accumulate the stresses, the fatigue of the muscles, fatigue of the joints, and premature breakdown is typically the outcome. There are no biomechanical evaluations. Again, we do the pre-participation exams, which is a medical screening, but no one is looking at them architecturally or biomechanically or musculoskeletally to see what are their imbalances and what can be done in an effort to reduce the chance of injury during their early years. And there's little to no prevention. Yes, they stretch, but that's not the prevention we're talking about. We're talking about looking at them biomechanically. The musculoskeletal system is the system that is at greatest risk with young athletes, yet we never identify any of the imbalances or any of the vulnerable spots on a kid's body before we put them into this high demand activity, and that's what we're talking about. So why parents are confused? Well, pains seem small. Johnny has a sore knee, a tight calf, a sore hip, and parents have to discern, is this something we need to get looked at or not? And you're questioning your child, how bad is it? Do we really? And then the issue comes up, who do I go to? Because the truth of the matter is, other than our program, there are really no programs out there that specialize in middle school, high school athletes. So we start with the pediatrician, we then get referred to the orthopedist, we then get referred to the physical therapist, and along the way, none of them have the ability to evaluate biomechanically what the underlying condition for that young athlete is. So we're treating the injury, hoping that it heals, and then we're sending the athlete back. Too often with coaches, we're under the no pain, no gain program. And remember, the coaches over the years, they've taken on a new role. They almost believe that they are the better doctor than the doctors out there. And the reason is because a lot of the doctors out there don't know how to diagnose the injury and don't know how to get that athlete to heal appropriately, so they'll keep them out for 2 weeks. Well, that's like the worst news a coach can hear. So a coach will say, fight through the pain, because that's what they learned. But again, that adds to the problem, because there is good pain and bad pain. There's conditioning pain, there's injury pain. And many coaches can't differentiate which it is, and therefore it's a dangerous environment for that child to be playing in. And then, are they really hurt? A lot of times, you've got a lot of dynamics on teams, kids that are frustrated at the coach, or kids that are being bullied, or kids that don't like to play, and then they have an injury to try to get out of it. And poor parents have to figure out, what's going on here and what is the best thing to do. So here is the best thing to do. This is Actuary Alex. We're going to talk about this a lot. Alex is a normal, uninjured youth athlete that has significant biomechanical imbalances, as all youth athletes do. Actuary, we know that structure is going to have a cost associated with it between now and the day that structure dies, which we hope is 95 years old. But the costs are going to be enormous, and the costs can be dramatically reduced. That's what we want. We want that child to have a good experience. We want them to be able to play the entire season, but we've got to do a much better job on preparation. So here is an example of one of the x-rays that we take, because it's measuring the height of the hips. And that measurement is the most important measurement in the body, because if that measurement is not level, the weight distribution going through the lower extremities is imbalanced, and the spine is sitting on an unlevel foundation, and that's while they're static. What is happening once they start putting motion into that structure? And what will happen is that one side will get excessive loading, the other side will compensate for it, and we don't know where the injury will be, but predictably there will be injury sooner than later. So common injuries with this age group is Sever's disease and plantar fasciitis, Achilles tendonitis and Osgood Schlatter, hip and low back injuries, and shoulder and neck injuries. And again, they're all magnified and accelerated due to the biomechanical imbalances. So the two tests that we want to make nationally available: Dr. Mag's leg length test, which is a very quick one-appointment test where the athlete is provided orthotics and gets one x-ray to measure the hips now that the feet are fixed. If the hips are more than 3 millimeters different, then you need a lift under the low hip orthotic. Or we have the comprehensive exam, which we love all kids to go through, the structural fingerprint exam. This exam looks at the entire body: range of motion, leg length, foot collapse, knee alignment, joint range of motion, and it gives a blueprint of that young athlete before they ever take the field. It should be the mandatory test done on every young athlete each year in this country. So here we can see a visual of what I'm talking about, and then here we can see the correction, and that's what we want for every athlete. So please consider finding out how to get that done. If you know of any young athletes, please forward this link on to them and let them know there is help. It's just we've got to put it all together. Thanks much. We'll see you next podcast.